What's that?
Do we have a spending problem? We're looking at a budget where, once again, you don't have a contingency fund for forest fires. You don't have a contingency fund for the cost of crop insurance. We're starting at a base about the same as last year after experiencing a significant increase in spending costs around $1 billion. Many would see this as a spending problem in this particular budget. This being election year, many would be suspicious of it. So do we have a spending problem?
Do we have a spending problem? I would categorize it more of expense pressures due to the growing province. So, you know, it is definitely record investment in education and healthcare, both of which I feel the timing needs to be, I feel it needs to be done at this point in time. We do have a growing population, and we perhaps aren't getting the revenues from that growth. We will into the future to help sustain the increases that we put, but we undoubtedly have more kids in our classrooms. We have to build schools, we have to build classrooms, and we have to put more resources in our classrooms. We have more people coming through the doors of our healthcare facilities. And so, you know, it is the growth that comes, then you get the economic benefit of that comes right after. So I think that I'm comfortable with those decisions that we made for this budget. I think the timing is now where we need to invest in services for people. And I'm also very comfortable and confident that our economy will support it and it will be sustainable into the future. Does that mean we can spend foolishly? The answer is absolutely no. It's tight. There's obviously a, you know, albeit small and modest deficit, it still is a deficit. We enjoyed having the very unprecedented large potash income over the last 2 years. We used $2.5 billion of that to bring down our operating debt, but we're forecasting now that potash prices will be more the norm of what we've seen historically, and where we're going to see the increases more is in the taxation driven by economic growth. You know, I'm not denying that people are struggling with cost of living, but that is, I go back to, we're still through measures that this government has made. We're the most affordable province in Canada. With the fairly substantive reduction in the personal income tax and then reintroducing indexing it, that alone will be for an average family of four at $400 cost savings or a savings on income tax alone in this year. Of course, I would be remiss if I didn't mention that we're not collecting the carbon tax on our energy bills, our home heating bills, which will save another $400 per year for that household. You know, when you look at measures other provinces have made, you also have to look at the entire suite of their taxes. And we are we're only second, I think, in some income tax levels in being the lowest income tax in the country. So comparing it for Manitoba, for example, a family of four can earn $20,000 more before they pay income tax in Saskatchewan than they can in Manitoba. So I would rather have that tax cut than a different tax cut that may only be there for 6 months.
And you see the board here, right?
Whoops.
On the mic now. Don't need the mic. Record spending everywhere. I think when it comes to expense, everything went up almost across the board. So what was the toughest decision you had to make in maybe saying no to something, or you sat down and agonized over a decision? Because as we see, spending's up and there's records being set all over the board.
There are undoubtedly more pressures than what we were able to address. There are ministers that come forward with perhaps new programs that, you know, we would like to fund, and I won't disclose what some of those are because maybe in the future we will be able to do that. We can't do it all, of course, and I think we went a long ways in addressing I would say, the more prominent pressures in healthcare, the largest, of course, being our human resource pool of healthcare professionals, and that is the number one expense in healthcare. That needs to be addressed first before you can deliver more programs. So that was a priority in the health budget, is to have the funding there for more healthcare professionals to come into our province. Education, the large injection we put into education, both in classrooms, which addresses class size, I think will be very necessary, and I'm really optimistic about the pilot projects that are underway, because some are going to be identified as more effective than others. And so I think in future budgets, we're going to look at then being able to replicate them in other schools across the province. We need to start to drill down as to what's needed and where. And that seems to be the biggest question, because the complexity is indeed very complex. So, we could have put more money there, but we're not sure yet the most effective way. And we're going to be working with all of our partners to identify that for future budgets. But there was no one major area where we sort of said, no, we can't do that this year.
Sorry, yeah. There was a bit of a surprise with pensions in the fiscal update in the fall, and I'm wondering if any of the actuarial assumptions have been changed going in so that there won't be sort of a surprise kick in for pensions in this year.
The surprise, of course, came with the change in interest rates, but I'm going to turn to Max for a more detailed answer to that question.
Yeah, so in our technical briefing, we outlined that there was about $260 million of expense related to pension indexation that was beyond control of government. So that was in addition to that amount. We've made allowance for that.
How does this budget account for a potential drought this summer?
Yeah, for budgets, we always basically budget the using historical data on what the trend has been, and this is not an exception. And then I pray a lot. There's no doubt, it's very concerning that we may have a pocket of drought again. We have the fund to address, a drought of like last year, but the previous year, of course, we were reliant on our reinsurance, and we still are supporting reinsurance should there be a catastrophic province-wide drought.
Just following up on that, why wasn't there a contingency fund for that?
There was only once where we did a contingency fund, and I'm trying to think of the year that we did that. But then that just, it's a number, right? A contingency fund is a number, so then your deficit is more, but it's not real because it's not designated to something. Ultimately, if we have crop insurance claims, we'll be there for the producers 100% each and every year.
And how is it that we're one of the more affordable places in the country, but how is that comforting to people who aren't really feeling that right now?
Well, we did address the most vulnerable by having the increases to all of our income assistance programs, as well as this will be the first full year, and I'm going to be remiss on the name, that subsidizes, but we have a program that subsidizes the low-income families. This will be the first full year of that program. So we did address the most vulnerable, and you can only support or forego a certain amount of revenue and still be able to support healthcare, education, and other services. So it is a balance of trying to keep the taxes low enough that we're, as low as we can be, but still have the revenue available to support services, because people want both. They want affordability, but they want to know that their child is getting a quality education, and they want to know that when they need health care, that it's there for them. So undoubtedly, it is a balance. We only have three three, significant streams of revenue, and that's taxes, transfers from the federal government, which is basically taxes we pay when we pay our federal taxes, and resource revenue. So there's no magic wand.
Right, just another one from the education funding that was announced already a couple of weeks ago. Teachers are saying that it doesn't meet the enrollment needs and doesn't go up with inflation. Just how do you respond to that?
Well, it's a pretty substantive increase, a historical increase to education. It is also a larger amount going towards not just new schools, but relocatables to address the class size, which is, acknowledging that with immigration population increase, we have more students coming into the classroom, so we need more classrooms. So we are adding more than normal new classrooms. In fairness to the teachers, inflationary pressures are definitely a pressure, but inflation is considerably down right now in Saskatchewan.
I think part of the growth that's planned in products ties itself to an increase in population. And attached to that increase over the coming years, we also see growing rates of anticipated projected unemployment. I was hoping you could just kind of help me square that a little bit, how there's a bit of a assessment or a banking on that growth, but then we also see projected increases in products.
I didn't know we were increasing.
Yeah.
We're not projecting increases in unemployment.
So 5.5% projected increases. So I'm correct on that.
I defer to my officials because I have not seen that. But the growth isn't just population growth when you look at economic growth. It is the investment from, the building of canola crush plants. It is the expansion of and the moving forward to the next phase of the BHP potash mine. It's different expansions that our other potash companies are doing so that you benefit from increased employment, increased people paying income tax, but they're also spending money in all of the local stores and restaurants. And so then you have that, but you also benefit from the companies themselves because, as we've seen, they pay a very high level of corporate income tax when they're profitable.
So that's on page 32, if I'm mistaken on that. The other side, too, I don't know if I missed it in the budget, but is there any money or any other consideration for the Saskatchewan Graduate Agency? I think that was proposed in 2022, and I haven't seen any update on that.
That hasn't changed. So basically, we've hired an outside firm to take a look at, what's the pros and cons of that. As I've said before, it is not something we're going to rush into without analyzing closely. There are some benefits, of course, because as we've seen in last year's budget, because of the timing that we realize the corporate income tax that's collected by the federal government, it is very unpredictable and it makes it more difficult. It's definitely one of the most volatile thing, again, other than resource revenues, to have to make our provincial budget, so that should we have our own agency, we would have those numbers in more real time than what we can now. But there's also downfalls that potentially to this, so we're not rushing into it.
Okay, first I want to apologize for basically almost cutting you off.
No worries.
It's my first time.
No worries.
And I apologize if I missed the number I'm about to ask you for, but there was an increase to the debt this year, and how much is being allocated to going towards paying some of that off?
This year, unless there's a windfall unexpected, we are not writing down the debt this year. Yeah.
And as we talked about before, we went from a $2 billion surplus to a significant deficit. Can you just elaborate a bit about what's contributing to such a fall like that?
$1 billion of it was additional crop insurance, which actually doesn't affect our cash because it is a fully funded program, but you have to account for it as an expense. So it looks like you've spent more, but but the crop insurance fund is very, very sound. It's contributed by the provincial government, the federal government, but also the producers. But when that fund is drawn down, we have to show it as an expense. That was one. As referenced earlier, there was an additional expense to the pension liability. Again, it doesn't affect your cash flow. That's recognizing a liability of pension payouts in the future, but that needs to be accounted for in public sector accounting. And the third was health expenses had gone up.
Yes, ma'am.
That was largely due to the settlement that we made with the doctors. And we then funded what we agreed to in the collective bargaining. The special warrant, the largest one was health, and that did include that agreement with the doctors.
Hi, I know you were asked, I kind of heard this last night, but now that you can speak a little bit more freely, I wanted to ask it again. This is going to be your last budget. Is this the budget that you wanted to bring?
No, it's not. I would have loved to have ended with the last budget that was balanced and able to do a tax reduction. However, it is the budget that I am comfortable with because I do think that where, my colleagues and our Premier decided to prioritize in substantive increases is the right thing to do right now. I really, truly am comfortable with those decisions. And so it isn't balanced. I'm also comfortable, however, with the economic growth that we're projecting, and we need to continue to be very diligent as a province to put in policies and incentives in place to encourage even more growth, that the large increases that we put in this budget in spending in targeted areas will be sustainable into the future.
Are there any places that you can identify that those priorities were high enough that you were comfortable going into a deficit?
Well, I think I've talked a bit about the classrooms and the fact that we have more kids, so we need more classrooms and we need more supports in those classrooms, because I've never denied the teachers bringing forward, concerns about complexity. We agree, which is why we made that decision that we need more supports in the classrooms. But I also, in the healthcare budget, the extra funding for women health, for breast cancer, I think is extremely important. And the other is to increase the funding for surgeries. In particular, what I hear back home is the wait list for the hips and knees. Cataracts, people are not so anxious about, and large part of the wait list is cataracts, but hips and knee surgery affect quality of life. So I fully think that that's a huge priority in healthcare. And of course, we need to keep moving forward with more and more supports in our mental health and addictions. And I think the fact that there's initiatives that we're going to be looking at targeting youth is going to be critical.
Minister, there, I think
We're good?
can you hear me?
Mm-hmm.
I'm just going to ask another question about the debt, because I'm just curious about how the debt is going to be addressed. I see it's up by about $3 billion, and you mentioned we're not writing down the debt this year, so just wondering going forward how that's going to be addressed,
Yeah.
because it seems like a bit challenging to keep that under control.
Yeah, no, for sure. So there's three sort of kinds of debt that we have that make that total. One is the debt in the Crown corporations, and of course, as with any business, they weigh their borrowing with what they need to do, but they also measure it with debt to asset value. And quite frankly, even though they're borrowing more, that line of measurement is pretty much flat, because their asset value has also gone up proportionately. So they have a mechanism, of course, to pay their own debt, because they generate revenue through the rates they charge for the utilities. The second debt is the capital debt. And, as much as we would like to cash pay for new schools, new hospitals, new highways, or highway repair and whatever, it's limited how many taxes you can collect to just pay for capital. So we do borrow for the capital expense. As we borrow, we invest some of that money into sinking funds that will help with future payments. The third is the operating debt, which we will not be increasing this year, and that's the debt we wrote down over the last two budgets of the 2.5 billion. Because that is the debt that probably keeps me awake at night, because that's the debt that really there's no revenue stream to pay for it. So we need increased revenues, and such as the time where the resource revenue was high. That's why we chose to take that unprecedented, unexpected revenue and use it to write down the debt. The positive thing is, again, you have measurements that investors look at and that the credit rating agencies look at, and our debt to GDP. So our debt in today's reality is quite manageable at 14% is what we're projecting. It is at a very comfortable second spot in Canada. And that is why we are able to borrow money, quite frankly, at a lower rate, because we're able to keep that debt to GDP ratio quite low.
Yeah, they were saying that the capital was really driving the debt.
100%.
And I'm just wondering what you think about going forward into the future. Is this going to be a challenge? Because we keep on hearing about cost of construction materials for capital projects just keeping on going up, and the cost of projects going up. Maybe get your thoughts on that.
I remember this before. Trying to think of the year, because I know housing costs just skyrocketed because the costs went up, and then they kind of plateaued and came down a bit. Because absolutely, projects that we were budgeting, $50 million to build is coming in, the tenders are coming in at 75 million or more. And so that's pressure that we're experiencing, as well as anyone who's, in construction. I don't think they will keep skyrocketing at this rate year over year over year. I think there will be a flattening. It has historically, but I'm just going sort of by the history of how that goes. There was the supply chain issues that were driving the cost initially, and I think a lot of those have been resolved, so hopefully that will help. The biggest pressure I'm hearing in construction that's going to be a cost driver as well is finding the labor for that construction is becoming more and more of a challenge, which is, again, a challenge, but it could be very positive. That means that more people who come to Saskatchewan will have a good paying job.
With the population growing, can you speak to any specific funding in the education budget that will go towards retaining and hiring teachers?
Every school, so the budgets go to school divisions, and there is a formula that they use to determine what amount of funding goes to each school division. It's based on number of students. It's based on the footprint of their facilities, like what's the square footage of all of their schools that need to be maintained and staffed. It's based on the number of kilometers that they're expected for transportation. So using all of those calculations, the funding then goes to the school divisions, and they have 100% control on how it's spent and in their staffing complement.
Going back to the carbon tax piece, although you're taking it away from home heating, Saskatchewan residents could see less on the rebate. They're also still paying it at the pump, as well as the fuel tax. How are Saskatchewan residents saving money with this budget?
Saskatchewan residents, as I said earlier, will save, going back to the household, an average of $400 per household, because they won't be paying the carbon tax on their home heating. As well, individuals, families on every income level are seeing a much lower income tax that they have to pay than other provinces because of its indexed. Again, as I said earlier, an average family of 4 will have their income tax reduced by about $400 this year due to the indexation. So it is somewhat cushioned from the impact of inflation. There's also a number of programs, and it depends, if you're a student, you get the Saskatchewan Advantage Scholarship. There is the Graduate Retention Program. If you're a senior, we had increased actually last year's budget, the subsidies that we give for ambulances. We have among the highest seniors income plan, which is a supplement to the low-income seniors income. And I could go through the list, but it adds up to about $2 billion of either foregone revenue or direct payment to help with affordability, such as the low-income tax credit, which is redeemable, and you actually get that money.
But if the carbon tax isn't being removed or isn't being rebated back to Saskatchewan residents, that would be offset, therefore residents are not.
We don't know what the federal government's going to do, so I'm not going to address the hypothetical.
Okay, sorry for going over here.
The budget here, it talks about community safety remaining a priority for the government in this budget, but I think, looking at other areas of the budget, maybe health or education, those are big focuses here. I'm just hoping you can sort of speak to what aspects of the budget highlight this idea that community safety is a priority.
Well, through these, we brought so that we could coordinate our safety, because it was kind of in a few ministries. We found when we had an emergency response that although our responders do an awesome job, there was a bit of disconnect as to who was doing what, and we thought it was better, and that's when we formed the Saskatchewan the Saskatchewan Public Safety Agency. We have too many acronyms, and I've got to think of the long term. That went a long ways in actually helping to coordinate public safety and identify areas where maybe we were lacking. And I would have to direct you to that minister for any more details on that. But also, we're continuing to build the Marshal Service, and that will be a service that will complement and work with our existing municipal police services as well as our RCMP.
I guess just on that topic, I asked this before, but I'll ask again. $7 million again this year for the marshals. They're not operational. What does that $7 million do, or I guess $14 million over 2 years? What does it do? What does it get us?
This will start the hiring, but I will turn to my official if he has.
Yeah, as we said, they're building the program, they're hiring the officers, they're training the people, and so we expect it'll be operational in the next fiscal year, 25-26.
We got time for maybe one or two more?
Sorry, thank you. 3.5 million, you touched on this earlier with knees and cataracts and things of that nature. 3.5 million invested to reduce surgical wait times and increase patient quality of life.
Are you able to specify whether that's dependent on the type of procedure and the level of sensitivity or how invasive it is, or is this just like hoping that you'll reduce wait times across the board for all kinds of procedures?
That's a really great question of how they measure, to ask the health minister.